All right, so we're going to talk about adjust culture today, mainly how that applies to improving outcomes through quality choices. The medical error I'd like to discuss today is a patient fall. I had experience with this in a post-surgical patient. So, a patient had a fall after they got out of surgery. Falls after somebody receives anesthesia medication for surgery can really be harmful to a patient. This incident that occurred, I was working in a post-op day surgery. They had already gone through the PACU and they were back to us. We were getting ready to discharge them. And no nurse was present with them when they were in the bathroom. And they had told the staff that they felt okay in going in there. Results that can happen from falls could be that they have to have repeat surgery. They might have a head injury. They might not have any harm at all. Or they, if somebody was with them and they fell, it could also harm the healthcare worker as they're trying to help them. Those are all results that can happen. In this particular situation, the outcome was that the patient fell on their shoulder. They fell on their surgical arm. A repeat surgery was needed. They needed a second rotator cuff repair. So the situation was that the nurse had honored the request of the patient to step outside of the bathroom because they wanted some privacy. And so they allowed them to do that, and that's when the fall resulted. There's several questions to consider immediately. I think from a management position and from a nurse perspective, as you're looking at this situation of, how should a patient orientation be assessed at this particular place in their post-op journey? At what point are they able to have the autonomy to request that privacy? What is the appropriate amount of supervision of a post-op patient? Does the nurse have to stay in the bathroom with them? Was she being negligent, or was she genuinely trying to honor the patient's request for privacy? I think those are all things that we can ask. So let's look at some resources that we have in creating a just culture. David Marks, in his video, he discusses several things that healthcare workers and organizations can do to work together to maintain a culture that is just. And his focus is heavily on improving outcomes. And so when you have a better system of justice, that is going to improve your outcomes. The focus for nurses and staff members, he wants them to remember that they do not have to achieve perfection. Human error is going to be an issue at some point in a lot of our careers as nurses, but we can improve our outcomes through intentional choices. We have several specific duties that we can hold to: a duty to produce an outcome, to follow a procedural rule, and to avoid causing unjustifiable risk of harm. He also talks about management and how in large corporations, what can they do? They can teach about how much quality of choices matter, and hold their employees to a high standard of intentional choices. So even if there's not harm involved, they're still holding people to that high standard of choices, whether harm does or does not happen. Management works on developing the trust of their employees, and as HR is developing policies, they need to console the human error, and coach the at-risk behavior and punish the reckless behavior in that situation. Consistency is really important when organizations are earning and maintaining the trust of their employees. Another resource that we have is from the Institute of Healthcare Improvement. The FMEA, Failure Modes and Effects Analysis, gives us steps in their process to analyze situations. They are asking questions like, what could go wrong? Why would the failure happen? What would be the consequences of each failure? So healthcare organizations have been using this analysis more frequently to help avoid adverse events and proactively make changes instead of just responding to adverse events. Changes can occur to improve outcomes when both nurses and the people in management are being honest. So we're wanting to avoid this second victim occurrence where the nurses have a fear of litigation, where there's an absence of a well-defined reporting system. We want the organization and the nurses to be able to trust each other in order to be able to implement that change through honesty, trust, and intentionality. I think through this situation at my hospital, there's several things we can work into our policy in order to prevent these types of things. One of the problems we identified was that there was too much inconsistency when helping patients up for surgery. We needed clear expectations in place for post-op patients. Supervision of post-op patients needed to be until they were discharged, regardless of the orientation that they were presenting with. We were still needing to supervise them when they were up out of bed. That also meant that management needed to make sure that there was an appropriate nurse-staff ratio in order for them to have us to have that appropriate supervision. We needed policies in place in order for us to know the clear expectations for these patients, and then especially if any falls were reported, that it was reported in the same way every time. And then a consistent response from the organization. They needed to do that. In conclusion, a lot of falls can be prevented in most cases with more clearly laid out expectations to the nurses and the patients and the organization as a whole. Nurses should know what procedures to follow after an incident occurs, because unfortunately these types of things do happen. And the FMEA should be used to analyze the risk of these things, and in order to pursue a just culture.